Our project is Meet Atlanta Primary Care. I'm Shannon Foley, and I was assigned an osteopathic physician. Michaela Glinsky was assigned a physician's assistant. Tyler Hadaway is a community health worker, and Emily Hang is a licensed practical nurse. My character is Amelia Havland. Dr. Havland went to the University of Florida and later attended the Atlantic School of Osteopathy. She is now 38 years old and is married with 2 little girls. She is an osteopathic physician practicing primary care. An osteopathic physician, or a DO, is a fully licensed physician who practices in all areas of medicine, but Dr. Havland chose family practice because of her desire to help all people, and especially entire families, and grow personal connections with each patient. DOs are trained to listen and partner with their patients to help them get healthy and stay well. She recommends becoming an osteopathic physician if you are looking for a patient-centric, more preventative approach to medicine, with emphasis on the unity of all body systems. She wanted to treat her patients the way she wants her family to be treated, in a more holistic approach. Although osteopaths do not receive an MD, they must complete 4 years of osteopathic medical school, followed by internships, residencies, and fellowships. This training lasts up to 8 years and prepares DOs for their specialties. Since Dr. Haviland opened her own practice, her schedule is fairly flexible, but her normal day starts at 7 to 8 a.m., 4 to 5 days a week. In a day, she can see anywhere between 20 to 30 patients, and she treats everyone, young and old, from anything from injuries to normal checkups to COVID symptoms. Her day will usually end around 6 p.m. when she will return home for a nice family dinner.
Meet Mandy Morrison, a 36-year-old physician's assistant. She has a husband and a 4-year-old son. Mandy was born and raised here in Atlanta and even went to Tech. To become a physician's assistant, Mandy completed a bachelor's and then took 2 years off of schooling to volunteer and get clinical experience before attending a master's program for physician's assistants, which prepared her to take the certifying examination, and then that qualified her to start working as a physician's assistant. To become a PA, it requires less time and schooling than an MD, so she was able to go into the workforce much quicker. What Mandy is not looking forward to at the moment is preparing for a recertification that she has to complete every 10 years. Mandy decided to become a PA because she loved medicine and working hands-on with patients, but she wanted a flexible job in medicine and didn't know what specialty. As a PA, Mandy can avoid the budgeting and bureaucracy of medicine that doctors face and focus just on patient care. Mandy worked in an OB/GYN office and moved specialties to now work at Atlanta Primary Care. Her daily work includes conducting all follow-up appointments, consultations with patients over the phone, and assisting Dr. Havland in complex procedures. Furthermore, as a PA, it was easy to make the switch between specialties because she did not have to go back to school like an MD would have had to. This is one of the biggest positives to being a physician's assistant. You can customize the profession to what you want because the licensing covers every specialty. You can do anything from assisting in surgeries to helping patients formulate treatment plans. Mandy also values family and wanted a job where she could have very regular hours, and she was able to find that as a physician's assistant. She saw how hard her mom worked as a child to balance multiple jobs, and so she wanted a profession that had job security, and with a projected growth for a physician's assistant of around 30% in the next 10 years, she found that job she was looking for. Mandy also makes about $100,000 a year, which is enough to allow her to support her family.
So my character is Emma Sun, and she is a licensed practical nurse. So an LPN is a nurse who cares for people who are sick, injured, or disabled, and they work under the direction of physicians, practitioners, and RNs. And there are many reasons someone may want to become an LPN, but one reason for sure is definitely an interest in the medical field, as well as wanting to have plenty of patient interaction. Furthermore, if you look at the graphs, there is a 22% growth rate for LPNs, so there is job stability, and there is a median salary of approximately $45,000 a year. So how do you become an LPN? An LPN has a relatively straightforward path. It's typically a 12-month program, and upon completion of the program, you take a national exam. And once you pass the national exam, you are certified. So, what about Emma's story? So, after Emma graduated high school, she originally began working full-time as a waitress to support her family. But when she was 22, she had the opportunity to enroll in an LPN program, which was perfect for her because she always wanted to be part of the medical field. And her program lasted about 12 months. And after she graduated the program and passed the exam, she was offered a job at Atlanta Primary Care, and she's been working there ever since. So, although LPNs typically work in long-term care homes, Dr. Haviland thought that Emma was super helpful in the clinic because she takes care of all of the vital signs and she takes care of a lot of the patient interactions. And daily life is never quite the same for an LPN because it depends on the patients each day. But some of the things that can be expected to do each day include taking vital signs such as the temperature, blood pressure, pulse, and breathing rates of patients, cleaning and caring for wounds, and collecting specimens from patients for medical analysis.
Elena Gomez Brown is a community health worker. She was born in Puerto Rico and moved to Atlanta when she was 10 years old. She became a citizen at 18 and went on to college to receive a bachelor's degree in health education. But you don't exactly need a bachelor's degree to become a community health worker. Only a high school education is needed, and you also need some certification in the state of Georgia. But having a bachelor's degree does help out on your resume. Why did she want to become a community health worker? Elena loved helping her community and the unique sense of heritage she had from her parents. She wanted a job in healthcare, but didn't exactly want to become a nurse or doctor. She didn't feel like that was the right thing for her to do. She wanted to feel more connected to her community. As a community health worker, she provides outreach to her community to help them have access to the best and most appropriate healthcare for their needs. She gives them brochures, informal counseling, and guidance on health to help figure out what's going on, as the American healthcare system is a little bit tricky to navigate on your own. That's also an example of kind of her daily life. She helps people. A community health worker doesn't necessarily have to work in a clinic. They can also work for the government. And so she provides this counseling, and the job is pretty relatively stable with an average salary of around $51,631 annually, and there's a projected slight increase in the amount of jobs for community health workers.
Our community health worker, Elena, refers people to the clinic and is one of the primary pipelines that allows Atlanta Primary to serve the Atlanta community, no matter people's socioeconomic backgrounds. Then Nurse Emma helps with the pre-appointment diagnostics at the clinic, such as checking the temperature of all patients, so when you walk into the clinic, she'll be the first face you see. After the patient sees the nurse, they go to Dr. Haviland for their first appointment to get diagnosed. Then follow-up appointments are with Mandy, who joined the clinic to help take some of the patient load off of Dr. Haviland. And of course, there's always the option for further consultations with the doctor as needed. And hopefully after that, the patients that pass through Atlanta Primary Care are healthy and ready to get on with their life.
One Wednesday afternoon, Elena Gomez Brown sees Christopher walk into her office with an intense limp. She sits down with them and they have a conversation and go through some informal counseling about what is ailing him and what are the best things to do with the insurance he has, and she finally refers him to Atlanta Primary Care for the care he needs.
Once Christopher comes to Atlanta Primary Care, he first needs to fill out some basic information forms because it's his first time here. And after we check his insurance and all of that, Emma takes the pre-appointment diagnostics such as his blood pressure, temperature, height, and weight.
Dr. Haviland gives Christopher a normal checkup focusing on the areas that bother him, and she quickly realizes that he has Achilles tendonitis. She begins to manipulate his ankle in order to relieve some of the stress on the tendon and gives him a brace to wear for the next week. She prescribes him some pain medication to help him manage in case the problem does not go away, but she is certain as long as he takes it easy, he will recover soon.
2 weeks later, Christopher returned to the clinic, no limp in sight. This time he met with Mandy for his routine follow-up appointment. Mandy performed all the mobility tests and spoke to Christopher about his pain management. He didn't need to take a single pill, just physical therapy worked. Christopher left the clinic that day and didn't need to come back because he was cured. After the appointment, Mandy sat down with Dr. Havlin to debrief on the case. Thanks for listening.